you for the invitation. So my intention is not to talk for the whole hour or whatever till 1 o'clock. I have a single cue card to talk. And even that's just to keep me on track, because I tend to sort of get impassioned about what I talk about, and so it's a way of grounding me back into everything that I think is a good thing to talk about today. It smells divine in here, right? It really does. So the very first thing that I'm struck with, and will be sort of interwoven into what I talk about today, is this sense of what is wellness and wholeness and community, right, is such a huge piece of that. I looked it up last night, actually. I said, okay, well, what's the official definition of wellness? Because, you know, it was a wellness series and thought that was important. And there's all sorts of definitions, right? But there is something about wholeness. There is something about sort of accepting all aspects of ourselves and really valuing what we need to be well. Right? I went to McMaster for my undergrad in medicine, and from the very first day, right, they talked about the biopsychosocial model. Right? And I think everybody now really gets that it's the biopsychosocial spiritual model. Right? And all of those things are important. And none of those things actually are enough to derail you. Right? So they're all important. And it's so interesting when people come to me, and of course I'm a Western medicine doctor, right? But I sit kind of right at the edge of everything else. And that's not because I'm actually a rebel, I'm not. I'm a pragmatist. Like, a lot of Western medicine works for certain things, but in fact, if you don't really support all of the different aspects of that, then people don't get well. And people don't move in the world in a way that is effective and happy and whole, and they can't give all their energy into the world in the way that matters. So, did family medicine here at Queen's, went back and did a third year in psychiatry, because I already knew that's where I was headed, right? And then did a little bit of a split practice, did a hospital-based psychotherapy, psychiatry, mental health care practice, and then a little bit of family medicine at North Kingston. And then I had a cerebral aneurysm in 2008, and that kind of stopped me. I was like, okay, right, okay. What is that trying to tell me, right? Where do I have to go for my own wellness, my own long term, right, longer term? Had a 2-year-old at the time. Oh my God. Yeah, and see, look, that still gets me. It matters. And so when I had the opportunity, actually, it was interesting, got exposed to neurofeedback, if you will. Somebody said, here, we've got this system, you know, Heather Pearson had a system that then Janet McCullough got one of them, and check this out, what is this? And it was this most phenomenal experience for me, because I had then, after sort of 15 minutes, sort of like a 5-day stretch of a completely unconflicted self-state, right? I just went. So all of the usual doubts that I was used to carrying around, all the baggage that I had on board, it was like gone like a miracle for like 5 days. And I was afraid I was hypomanic, right? Because, you know, I wasn't used to having all this energy. I wasn't used to having all of this. But I wasn't making bad decisions. I wasn't doing anything. And then I started to kind of climb down, kind of settle back into my normal, you know, neurotic self. And then I bought the system that day, right? Because I figured something was different. Something was so different. And that it was a tool that would make a difference to, I think, a lot of people, myself and a lot of people that I was treating. So this isn't actually how my talk was going to start, but here we are. Right? See, I told you, right? I just go. Anyway, it seems to me, I guess, that in the last sort of, 100 years or so, people have had more symptoms. They have had more discontent, more distress, perhaps more stuff that they're carrying around, more chronic illness. There's a lot of debate as to whether that's actually something that is just because we're more aware of it or whatever. They're now starting to think, no. I mean, there's something else going on. And I think there are a number of ideas around that. Some of it has evidence, some of it are just ideas. around sort of the toxins that we're dealing with, around some of the dietary things and the genetic modification of some of our food, and like a number of other things with respect to, just the EMF that's in the air. I mean, there's a whole bunch of theories, right? But the idea is that a lot of people are actually struggling in ways that I think is new to this age and getting worse, getting harder to live a full and uncomplicated life, if you will, which is, I think, what wellness is to some degree. And we also have the wars, of course, right? You think about how they were spaced out generationally. There's what they call the intergenerational transmission of both trauma and actually the good stuff too, right? It all kind of comes down. Our ability to believe we can cope is also one of those things that tend to come through families and so forth. But just the idea that these wars also had a big impact on just how much traumatic activation we're carrying around in our system that's actually impacting and influencing, how we're able to live in that free way. So the model I'm going to talk about today actually is an interesting one, because Dan Siegel is a neurobiologist who is, yes, I'm nodding already, right? So he's a big guy. He's a big gun, right? He's a neurobiologist. He does a ton of work on the neurobiology of attachment, and how it is that we can actually feel safe in the world, and what is it that determines that, what is that, how is that we can promote that. And he works out of UCLA and has what they call the MindSight Institute, and he is a big mindfulness proponent, okay? Awareness. And he has something called the Wheel of Awareness, and that's his model over the last, again, nods, right? So I'm preaching to the choir here, but bear with me for those who aren't familiar with it, and please correct me if I'm not getting it quite right, because a lot of things I'm talking about today, I'm not actually expert in a lot of it, right? But it all weaves together with how I see health and sort of the things that I reach for to help me understand and help people. So the Wheel of Awareness runs something like this. He says that self is like a big wheel, right? It's a big circle. On the outside of the wheel are all the things that we're actually quite sure about. So our beliefs and all of our conceptions and all the things we automatically do, all of memories, whatever. So all of the things that are fairly certain in our self. Now here's what gets interesting. The inside of the wheel is actually the point of all possibility. So the 0-point field for the quantum physicists, right? The idea that at the core of the self is actually this very, very fluid, flexible, whatever that is, right? Doesn't even have words. And so at the center of this circle is actually zero probability, right? So that we are always within this wheel, sitting essentially in that 0-point field, and with our attention being the spokes, right? And that's actually, so the spoke, your attention goes here, and that thought happens, or whatever. Our attention being a really important modifier. I would say that and our curiosity being the modifier of some of the things around the rim. And as I think about this fits really beautifully with much of the neurofeedback we do, which is based on a complex dynamic theory. Because all of the things that tend to cause us symptoms, stuckness, suffering, right? The things that really we'd like to change often are things ways we get stuck here or here or here. So it's the ways that our thinking gets stuck, the ways that emotionally we're drawn and pulled to certain things, and it's the way that gets in our way sometimes. So the idea of a healthy whole self being that fluid and flexible ability to shift attention easily is an important piece, I think, in what's coming. And I think it's a model that draws all of the disciplines together, which is such a great thing, right, as we go forward, because without that, I think we'll just go down another blind alley rather than start to really integrate this. So anyway, let me just talk a little bit about the complex dynamic neurofeedback. So it's based on, as you probably know, it reads brain waves, right? So what's already happening in the brain anyway. And it's a very, very elegant but simple idea. It is that Some of these stuck places will have a signature in a change of frequency amplitude, right? It's called a state shift. Just before the brain starts to shift and lock into something, there will be a big spike of activity that looks like turbulence. And so it looks for that and it interrupts the music you're listening to. And that's it. That's all that system does. And it sounds deceptively simple, but if you think about it, probably targeting that which is buried, that has what they call autonomic activation to it, right? So that fight, flight, or the collapse piece, intensity, emotional intensity. So it preferentially then, in those moments your brain is just going there, in that stuck place, interrupting something, triggers the orienting reflex, which is our normal, it's a physiological reflex that lets us sort of reappraise. It's unconscious, but it's like, what was that? And it actually interrupts and perhaps preferentially makes those pathways more flexible and able to be changed, right? So what people find is that, things that used to get under their skin don't do that anymore, and they feel more just generally content and well. They can use their energy in the ways that matter to them. They don't feel as stuck. People they had a lot of interpersonal conflict with, or at least a reaction to, tends to then be like, oh, okay, rather than, oh my God, all right? So again, that sense of being much more in the center, much more fluid, right? Be able to shift attention without being stuck. It's a much more efficient place. So works very well, especially if anxiety is a component in attentional problems, and it actually helps very much metabolically too. We didn't expect it, but people who came in with diabetes, left on half the insulin that they came in on, right? Or people who had that white coat hypertension, right? Their blood pressure spikes whenever they see a doctor or stress-related exacerbation. They were more level, right? So a lot of the autonomic nervous system instability was calmed through this. Immune system stuff tends to respond to it too. And I know as I talk about it, it's like, does it do everything? To some degree, yeah, the brain changes, right? The brain is actually very, very plastic. And I've come to the idea that I haven't come to the idea, I've come into agreement with the idea, because I used to think it was bogus. When I first got into neurofeedback, the developer of the system said, this works unless something is stopping it from working. And I said, how convenient. Right? I was like, okay, so, blame the person who's being trained, and, but I've come to actually agree with that. I think that there are a number of ways that we can facilitate, and if it's not helping the biopsychosocial system become more flexible, right? And the other piece to it as I'm there is it becomes more flexible, and it becomes harder and harder and harder for you not to be in your truth. So the awareness of the fact that you're in a job that is not what you want, and the fact that you're deciding to make those decisions every day for maybe not a reason that's as valid as you thought, right? Or whatever. So change happens from many levels, not just stability, but the more stable the brain is, in fact, the more you're able to really be who you are and make the decisions that really fit what you need, right? So there's that piece of it, which sometimes rocks the boat, by the way, especially in relationship. But anyway, so the more flexible the system is, okay? So what have I found gets in the way? Let's think about that for a second. Biologically, I would say what facilitates the training, we'll go there first, is all the things that we know. We all know this. Whole food diet, right? The closer to nature you can get, the better, right? Processed foods, sugar, they circuit the metabolism, right? What we're really looking at biologically to facilitate stability in any realm, whether you do neurofeedback or not, is really controlling the inflammation in the body, and also optimizing the mitochondria, right, which are the energy factories of all the cells. So those are the two things that often end up needing to happen to stabilize the system, first of all, and certainly to facilitate the training. So in that realm, whole food diet. Exercise. I might need to go to my yellow card here because it's not coming so quickly when I'm trying to use my left brain. Here, let's do this piece. Side B. Yeah, low to moderate carb, right? There's growing evidence that in fact, that high carb, low fat diet that they thought is really good for cardiac stuff isn't as good as they thought. Generally low glycemic index foods, again, you know this stuff, but I'm going to say it for completeness because it's important to know that this is a piece that they just don't talk about. It's not just for those who can. It's really quite important and raises a lot of issues with respect to sort of food security and so forth, which I'm not going to go towards. But the idea that a lot of people in our society don't have enough money to buy what their body needs to be well. Exercise, absolutely. Left and right brain integrates. Left prefrontal cortex lights up with exercise, right? Really super important. Yoga, fabulous. Tai Chi, right? All of those things that tend to help the body and bring your mindful awareness to the movement in your body. Okay. Supplements that I tend to really talk about, and I say, while you're doing neurofeedback, I think this is a good idea all the time, right? But I say, while you're doing neurofeedback, let's help your brain have what it needs to change. Right? Lots and lots of us are low in magnesium, so that would be probably the top of my list. Fish oils, omega-3. If you tend to have more anxiety, then higher EPA to DHA ratio. If you tend to have more trouble with focus, higher DHA tends to work better. But there's no bad omega-3, so lots of it. Really good for the brain, good for everything pretty much. Vitamin D in the winter. Again, we're in the northern hemisphere. Everybody needs this, not just the people who have seasonal affective disorder stuff. Add to that, I tend to add to that B vitamins, and I tell you why, because if I hear that there's sort of a transgenerational difficulty with depression or anxiety or something like that, or chronic fatigue or something, I'm already thinking, okay, wait a second, we've got some genetic variability here, perhaps that's at play. Right? Or we have, some other mitochondrial stuff that we have to work with very specifically. So I do a lot of sort of nutritional supporting of pathways. I mean, I do definitely use medications when I need to. It's in my toolbox, but I tend to try and support the body in changing. So the B vitamins, there are a number of them actually that have genetic polymorphisms, which are just different genetic ways they then fold after that are not less effective in some of the main nutritional pathways, especially the B vitamins. Right? They say about 15 to 20% of us have trouble with the folate pathway, right? And so that the most bioactive form of folic acid doesn't cross the blood-brain barrier, and the brain is basically starved, even if you're eating folic acid improved bread, right? So there are some times when I say, well, you know what, we're gonna take that completely out of the equation and use what they call an advanced B vitamin formula from AOR, which is all of the already most bioavailable forms. Right? And sometimes that alone can make a huge difference, before someone even gets towards any significant amount of neurofeedback. Could make a difference.
Linda, may I ask you to raise your volume a bit?
I can try. Sorry. If there's significant systemic inflammation, right? If somebody has, but there's a lot of things that actually can have, and you're quite aware of them, I'm sure. The three big guns, right? The big guns are N-acetylcysteine, alpha-lipoic acid, and acetyl L-carnitine, right? Those are all amino acids, right? Mm-hmm. And they're really quite good. I'd add turmeric in there. That's kind of a no-brainer. A lot of people use that. So the more there is inflammation in the system, the harder I have to work at stabilizing that. The caveat, and I just have to say it for anyone who's thinking about doing this, is if you have amalgam fillings, be careful because it'll pull out the mercury, because it'll just clean your system right out. So these things, you can hear, right, I'm half a naturopath by necessity. Again, I'm a pragmatist, right? I just kind of, you walk beside someone, and if they're not really getting where they need to go, you just start figuring out what that individual system needs. Right? So the complex dynamic neurofeedback is super, it's a big piece of what we do. It's really quite effective. Probably 75% of people get what they need from that. And the better I am at learning how to facilitate the process, the more people actually get what they need from that. There are certain periods of, certain things that I think need more than that, right? And one of them that definitely comes to mind is traumatic brain injury, so history of concussion. And it can be even a minor one, and it can be a minor one in childhood. And it can be actually there without us even knowing it's there in our history, right? A, because they didn't pay as much attention to it. B, because, you know, I didn't really want to go home and tell mom I was doing something stupid, right? Or it just sort of doesn't get passed on in the stories. That actually creates what they call that attractor on the rim. That's really hard to shift with a number of things that you do. Can you with time? Absolutely, right? Can you compensate? Absolutely. Right? Because if there's one thing I've learned, it's not about your genetics, and it's not about having the perfect childhood. It's about actually learning your system and learning what you need individually to support yourself, and to bring it into that sort of grounded place where wellness is. So TBI definitely is one of them, so you can work with it for sure, but that's something that can need more intervention. Post-traumatic stress disorder often needs something different as well. Now you can keep doing the complex dynamic neurofeedback, it keeps resetting you, but it doesn't last. You don't hold that space. It gets pulled back into the old patterns. Neuroinflammation I talked about already can really interfere with that, although that's modifiable. So there are other forms of neurofeedback that we actually end up sort of becoming involved with by necessity. We use sound sometimes to disrupt certain things. We can use a custom binaural beat, especially if there's a physiological sensation associated with something. You don't even have to know what it is or what it was. You don't have to have a memory. But sometimes that can really be helpful to use sound. We use hemoencephalography. I brought some toys to show you actually afterwards. Frontal lobe training, you know, and again, just sort of working with the flexibility of the system can really be helpful. And we've actually gotten into more of the complex and interestingly, more evidence-based forms of neurofeedback, which are the 20-channel 3D neurofeedback systems, right? So we have that at the clinic as well. And that measures all the different frequencies at all the sites very specifically, and it then enables us to create a more specific plan saying, all right, you know, this area right here needs more of this, less of this, needs to be connected back here. So we can customize something, right, for people who need that. The reason that's been really important to us over the last 6 months or year is that increasingly we have recognized, everybody's recognized, the field has moved very quickly in this, is that in fact brain networks matter. Right? So if you have a traumatic brain injury, or if you have sort of even sometimes a developmental history that's significant, or a number of different things actually can stop the major networks forming well in the brain, and then it's just always a struggle to keep equilibrium, right? To really, and you just tend to slide back into these things. We do a lot of work with kids now, and they train beautifully, and if we target those networks, especially in learning disorders, we don't even touch the brain areas that's responsible for reading or this or that. You just target the networks themselves. The brain just goes, okay, thank you, I can do this, right? And they're gone. So that's been really exciting over the last little while. But that's such a small piece of really what I do. It's there, the technology's there. It's great that it's there because some people need it. Because honestly, what I do much more of is what I spent the first, however much time talking about. How do you support all those spheres of your life to facilitate change? Right? How do you sit in that place of non-judgment and curiosity to start to look at these places where we all get, stuck, different places, but we all get stuck certain places, right, without shame. How do we see the system in a way that we can work with it and really help people move forward to more flexibility? And really, it's not like I don't want to be here and I want to be there. You can try and do that, and some people convince themselves they can do it. But real wellness, I tell you, it's flexibility. It's being able to be in the moment, being able to be with what comes towards you, having crappy things happen and rebounding faster, right? Because the crappy things are going to find us, right? There's just a lot going on, right? There always has been, and perhaps more now. So resilience and flexibility end up being what we aim towards, right? Because I think that's wellness, as opposed to any particular definition. So look at my little card here, but I think I've done most of it. Yeah. Oh, I didn't talk about food intolerances and stuff. Yeah, okay, let me do a little piece of that, because I think that's worth talking about, right? Because sometimes in the system, you say, okay, what's stopping the system from moving forward and through change? And in fact, sometimes it's that there is a chronic irritation to the immune system, right? And food intolerances are actually, I think, more common than we think they are. Elimination periods are a really important piece, and a lot of people know a lot about this, but so I won't say much, but good 2 or 3 weeks off wheat, always worth doing to see. Because you may not have the gut stuff, you may not know, it may just manifest as kind of fogginess, right? So I always say, good 2 or 3 weeks, 100% off wheat, or gluten rather, 100% off, don't cheat, and then have a big pizza, right? Because in fact, even if it's just, I'm not sure if this is okay, if you have wheat, reintroduce it to the system, right, you'll often go, oh my gosh, I can't think anymore, or something, right? It can be subtle, but that's an important piece. So the big players, you probably know this again, but gluten is a big player, dairy tends to be a big player for many people. The nightshade family tends to be a big player in my experience, as potatoes, tomatoes, peppers. And again, you may not have physical signs of this. They may just be sort of emotional irritability, emotional lability, right? Or hard time focusing, right? Things that we wouldn't think about for food intolerances, right? Can make a big difference to the system. And again, you try it, and if it works for you, great. And I think that's true of everything that I've talked about. And I think life as such is like, okay, well, how does that work for me? And the proof is in how you feel, right? And the proof is in how, do you feel grounded? Do you feel able to hold your space in relationship? Do you feel able to move forward without feeling held back or confused, right? So that's the proof, right? No matter what I say is a good idea, right? If it doesn't work for you, don't do it. But finding the things that work for you, I think, are important. I think that's it. That's it. Are there any questions or thoughts or comments or?
I'd like to know what a neurofeedback appointment looks like.
Sure. Yeah, it depends a little bit on what form you do, right? So the complex dynamic type that I talked about, like I said, probably 80% of what we do is that. Basically, you go in and you have a little sheet that you fill out, and you just sort of rate how your anxiety and your mood has been, how your concentration, your energy, your motivation has been, sort of just the functional things, right? Then a technician, certainly after the first time I tend to do it, right, with people to walk through and answer questions, but after that, a technician will take you into a room. Generally, it's kind of comfy leather, lazy boy type of thing, right? They'll put electrodes, right? If anyone's had a sleep study, they use a lot of these. We don't use as many. So electrodes right over the sensory motor cortex, the reading electrodes here, and then reference here and here, and ground at the base here. So reading 2 channels, right? But again, we're only looking for variability, right? So we're not reading specific frequency. We're not trying to change specific frequencies. We're just looking for variability. So, it doesn't need to be more than that for that purpose. And earphones in, right? They would run a baseline just to get a sense of where your brain is at to begin with. That's just a movie, a 30-second movie of the electrical activity of your brain. And they would put a piece of music on that you would choose. They would start the session and they would leave. You can do anything actually in the session that tends to work, but most people kind of just put their feet up and relax, right? There is visual display, and the visual display is actually just it's a Windows media player, right? It's the fractal image generator, right? But what happens is when there's interruptions, right, it tends to change, right? So there's some feedback coming back from the visuals, and a lot of people really enjoy them too because, you know, color tends to, and music tends to evoke the right brain a little bit, which is nice. But you don't have to, you can close your eyes. You can actually fall asleep and it still works. I know, right? Because in fact, it's a brainstem reflex. It doesn't care what you're doing. It's resetting it anyway, right? So some people read and stuff because, you know, depending on how much trauma someone carries within, sometimes closing their eyes and being alone in themselves is actually really difficult. So by all means, bring a magazine, whatever you want to do, or if you just like to do that, that's fine too, whatever you'd like to do. The sessions are about 30 minutes, 33 minutes, right? And at the end of that time, someone would come, do the same thing, do baseline, show you kind of what your brain has done, and really all we're looking for is change, right? Because we're not trying to make the brain do anything, so whatever it actually does with that information is fine. That's so does baseline, see what the change has been, and then then you're done. Take the electrodes off, and you're done.
I may be the only patient in the room, I don't know, but if you wanted to ask me what it feels like as a patient,
Okay.
But yes, you just sit in a chair with stuff on your head and you read a book and you don't know anything's happening and you're going, and it just goes along. And they show you the baseline, and usually your brain's like this, and then afterwards it's more like this, and you think, that's interesting, because you don't even know what's happening, it's all subconscious. But the last time I just came back up, I'm seeing you Thursday, and I fell asleep, which has never happened before, so I think it must have really dropped me down. It was quick. I've done quite a few sessions before, and I've never fallen asleep before.
Mm-hmm.
That was encouraging.
Yeah.
But it's great.
So what is the feedback loop? I understand the electrodes are monitoring, but what's the feedback process? Are they also, like, what's feeding back into the brain to make it then, instead of this, to go like this?
The music goes on and off as you.
There are interruptions to the music.
Okay, so the music is somehow, as it's noticing these changes, then it changes.
It goes
It
on
does
and off.
something to make your
it's
brain
an
do
interruption.
different.
So it doesn't matter
Okay.
what music you use, provided it's reasonably, soft and melodic and not kind of hard rocky or, Metallica, unless you want your brain revved. But, so it's an interruption, so it sounds like kind of a scratch on a record or a click, yeah. And again, you may or may not notice that, it's quite phenomenal, right? And many people at first, they come out and they go, I don't know what this is really doing, how can that possibly do anything? I'm sitting here and it's just,
So
I listen to music.
So whether you hear the click, the sound or not,
Yeah.
it still is.
Yes, it's so strange, it does not.
It's not
So what
totally
is that
sound-based.
doing?
Triggering the orienting reflex, right? Which again is unconscious, right? It's automatic, it's faster than our
So
conscious
it's
thought.
sending a message to say, stop peaking like that.
Yep.
And come back down to, is that what's happening?
It's more, whatever you're doing, if suddenly that happens, right? It's whoa, what? That's the orienting response too, but this is much subtler, right? So it's more, it's like going, oh, like, wait a minute. Not consciously, but the brain sort of has a pause, and in a complex dynamic system, as soon as you introduce something, it actually does reorganize, right? And so, it just has that opportunity to reorganize. It's like it invites the brain into stability, though. It doesn't push it in any particular direction, right? It invites. And if the brain actually needs a push because of TBI or something else in it, something that's really got a hold of it, then we need to use other methods as well.
Is there no side effect from this neurofeedback or dependency on the neurofeedback? If somebody has some anxiety or...
Yeah, you know what, if the process is going the way it should and does many times, there's certainly no dependence, because people do, usually they do about 18 sessions, but half the people are done then. And that number, I think, is climbing the better I get at sort of supporting the system. So they're done. They're like, okay, thanks very much, got other things to do, and they don't generally, and sometimes they come back if they have another particular trauma, but there's no dependence on it, no. And as far as side effects, it can actually exacerbate symptoms initially, only because as any symptom is, any system rather is starting to reorganize itself, sometimes it kind of, you're more aware of it. I think it increases awareness of actually everything, but the symptoms do. So just let me finish that and then I'll answer the rest. So session 3 to 6 is notorious for having that happen sometimes, but I would say that only happens in maybe 20-30% of the people, and it's usually something that they just, move through and keep training through, and they're fine. And then it starts getting better.
But like 5 sections for the Queen's student, right? There's some session for the Queen's student.
There's some what?
There is a Queen's student can have some session, 5 sessions.
I don't know.
5 at the Neurofeedback Centre.
At where?
I don't know the name of the center.
Do they have a system there?
Sorry, I forgot the name of the center, but there is an offer for the Queen's student.
Ah.
And there's a 5 times and one session. But one of my friend's son, he's taking the neurofeedback there, and then he's taking the 5 times one session and the 3 session. Do you think is it okay for them? Because my friend doesn't speak English, that's why I came here. And, but my son's friend take 3 sessions, like 5 sessions, 5 times 1 session, like.
Yeah, I'm not sure who's offering that. So 5 years ago when we opened the clinic, I mean, we were the only ones from the east of Toronto, right? And now, because it's really coming forward, there are many different people that are offering it. I'm not sure what your question is, because I'm actually, there are many forms of neurofeedback, and I'm not even certain that he's doing what I'm talking about here. May well be, but unless I knew who was offering that, and I'm not familiar with that.
The Princess Street, there's some center for neurofeedback, and they offer some special offer to the Queen's students. That's why my son.
Okay.
My friend's son is taking the session.
Okay.
But she's wondering that, like 5 times 1 session, she think maybe it's enough, but 1 more session and 1 more session, like 3 sessions, like 15 times.
So again, first of all, I'm not certain that I know what system is being used there, so that's the first thing to really know. If it's a complex dynamic system that I'm talking about, then yes, people do need more than 5 or 6 sessions. Generally, I mean, some people know right away that it's making a difference, but generally speaking, 8 to 10, you really get a sense. 12 to 14, you're really at the peak of what it can do for you. And then a few extra just to really help the brain sort of settle in that new place. So we talk about 18 sessions, we do that right up front. So if they're using that system, then I would say, yeah, and he thinks it's working for him, then yeah, keep going. But I would do, if it's the complex dynamic, I would do certainly 8 before you would make a decision as to whether it was working or not.
I was just wondering, how do you get an appointment for a neurofeedback session? Because do you need a doctor's referral, or what's the procedure there?
Right. So up until very recently, you have needed a doctor's referral, right?
And why would a doctor refer you to your session?
Oh, many different things. Sometimes it's because of mental health symptoms, right?
I see. Okay.
Sometimes it's because of concentration or peak performance, because it works extremely well with respect to that. Yeah, it's so up until recently we've had to have a referral because we really wanted to also, because we're conservative, first of all, and we really wanted to engage the family docs and know, so they would know what was happening as well, right? But very recently, the doors are opened. Now, docs are being requested to still refer, if somebody has quite a complex neuropsychiatric history, we still need to follow them. Traumatic brain injury, because they will often need something else. PTSD, again, it's a matter of safety issues. And other than that, you're welcome to come in and do sessions. The intake coordinator at their discretion might say to you, you know, it looks like you've had kind of a significant history, or I really feel like a doc, you'd benefit from a doc following you, and that can come in separately. You wouldn't necessarily need a referral for that, but yeah.
Just along the same lines of the past two questions, I'm thinking about accessibility, and if this sounds like a really positive alternative to some of the more conventional treatments for things like learning disabilities in children and this kind of thing, I'm wondering how accessible is this treatment? I'm thinking specifically for children and families who are struggling with these kinds of issues. You know, if there's not a referral that's needed, then is this all private? Is this, or is there a public health model here? Or are doctors able to sort of prescribe this kind of treatment for patients, or does this have to be a family-led or individual-led wellness? Because you know, there's kind of this divide between health care treatment that targets symptoms and this wellness model. So this is more along the lines of a wellness model. So it's a bit more on the responsibility of the individual, a bit more private. Is that the sort of the model right now?
Well, the neurofeedback itself isn't covered by OHIP at this point.
Sure.
Now, it is covered if you have benefits for a psychologist, right?
Yeah.
And up until, again, very recently, we didn't have a psychologist that was working with us, but we do now. So that's something that will help, I think, accessibility-wise.
Right.
The other piece is, honestly, that we've had a real dedication to accessibility too, right? So we've never turned anyone away.
Oh wow.
So we just do what it takes, right? So, yeah.
And is this, and sorry, and just to follow up, is your clinic unique in Ontario, or would you say that there are clinics in many cities that have the same dynamic approach that you have been speaking about here? Like, it sounds like that your specific approach to this healthcare model is really unique because you're looking at that wholeness factor in foods and all of these things. Is this something that you would say is happening in a lot of different cities across Ontario, or can you speak to that?
More and more and more, I think, because the evidence is growing. The American Academy of Pediatrics now has neurofeedback right beside medication for ADHD, right? So there's more and more evidence, more and more, and so I would say that it's a grassroots movement still. And and a lot of the people that are doing neurofeedback actually are on the same philosophical model, for sure, as far as wholeness and that sort of thing. They're not all docs. You know, there are a handful, but a lot of psychologists, handful of docs, and a lot of just practitioners and counselors and a number of different things, because it's up until recently not a regulated industry, right? So it is more so now, and with the Loretta, the 3D, that definitely is, that's more of a, you have to be certified to do that and stuff, so it's not. But the complex dynamic system actually is a peak performance tool. It's not even a medical machine, right? Which makes it ideal to send north to communities that don't have a lot of healthcare access and stuff. Yeah, we did a fetal alcohol syndrome pilot, which was really, really positive, and we kept hoping that would kind of grow. But funding is scarce for this sort of stuff, right? So it's not being, it's tough. But,
May I ask you a question about the supplements that you mentioned earlier? Because I know there's lots of choices and vitamin D and particularly with women over 60. Like what kinds of dosages would you be recommending?
So generally speaking, 2,000 IUs is safe for pretty much everybody, right?
2,000 milligrams? 2,000 IUs.
Yeah, that's much less milligrams. yeah, you don't want that. Vitamin D is one of those things that you can actually, it's fat soluble, so you can actually have too much of it. It can create an acidic body. You don't want that. So I generally say 2,000 IUs is safe for everyone. If I really think that somebody is vitamin D deficient, or if they're having a real difficult time with chronic fatigue, fibromyalgia that's not moving, then do vitamin D levels and just really see where they're at. Yeah.
What about magnesium? Isn't there supposed to be several times a day or a certain dosage each time?
Well, I'm not a purist. I tend to use magnesium at night and recommend it at night because it's so good for relaxation and sleep, right? And if you take it orally, it's pretty nice because if you have too much and your body's not absorbing it, you tend to have diarrhea, which is a very clear sign. Right? So you can actually get topical magnesium, right, for if you can't swallow the oral or something. But you got to be careful, right, not to. That doesn't have the normal sort of signal that you've had too much, and you can have troubles by having too much magnesium. So, yeah.
When you were talking about working with a client to create an environment where this is going to be more effective, how would you determine that from this questionnaire that you were mentioning? Or do people come and have a session with you before they actually start?
Oh yeah. Up until this point, actually, you come in and you meet with somebody anyway, no matter which stream you're coming in. If your doctor's referred you, then you sit down with. We have like a registered nurse that does some of the intakes, or I often do a lot of my own intakes, and we'll sit down and just get a sense of what's been happening and so forth. And often, unless something's glaring, I'll say, okay, let's get started and see what happens. And by 6 or 8 or so, if somebody isn't really going, holy cow, like I can't really put words to it, but there's something really different, and I'm not yelling at my husband and whatever. If they're not really, or whatever the things that used to get under their skin, right? If they're not really noticing a difference, then I'll at that point I go, okay, let's take a step back and reevaluate. So I certainly do the education around whole foods, and I will put them on the basic, like I said, the basic sort of 4 supplements and that. But the extra stuff, the tailoring of, because you can actually nutritionally support different neural pathways for the neurochemicals too, right? So you can actually sort of do some detective work with what might be happening and some of it's intuition and a lot of it's experience. I get better and better at it with people. Yeah. We're using something else, and I didn't mention it, which I'm just going to really quickly as well. The last 6 months or so, I've been using more and more of what they call pulsed EMF. So that's very, very, very low intensity electromagnetic field energy. And that has been a huge player in fibromyalgia and chronic fatigue and chronic pain. Right? So it has been a really important tool for that. And again, very, very low intensity. And it's actually an important tool for brain-wide. It's actually a neurofeedback adjunct is what it is, but works really well on the body. So we use it that way as well. But again, just lots of different tools, and a matter of what does somebody need to help them. Because again, if you're thinking about Dan Siegel's model, he's really not saying, well, what do we have to do to get somewhere? He's saying, what do we have to do to remove the block from that system being resilient? Right? And so that's where I come from too. Like what is stopping this brain from being flexible, this human being from, feeling grounded and emotionally stable, and so
yeah. I don't know much about the brain, but I just have a question about, so it was described as a wave that's like this, that you're sort of bringing down or changing the shape of on the screen. I'm not quite sure what that means, but are there occasions where this kind of brain activity may be beneficial, and then does that become prohibited if someone is changing their brain function to look like that?
It's a good question, right? That particular system doesn't try and change the brain in any way, right? It's just increasing its own flexibility. What was being referred to actually is that 30-second movement I was talking about. There's a measure of what the degree of stuckness of the system is. Let's put it that way. That's kind of the measure. It's a proprietary to that. And so it's not brain waves so much as it can have certain frequencies that have kind of more or less. Mm-hmm. So that's why, you kind of got to see it. A lot of trainers don't even use the baselines though. A lot of them pathway, that's not what actually helps the brain change. It just sort of offers some visual to what has happened.
So I guess any way that the brain is being encouraged to change through this feedback of the disruption in the music, the brain is changing in response to that, and that's seen as a good sign. You're saying the brain changing in how it's responding? You said that you're looking for change? Like, I guess how long, say you have 18 appointments or something like that, and the brain has responded in different ways. Are those ways of responding maintained, or can the brain respond in the way it did prior to those appointments?
So the complex dynamic neurofeedback is like a catalyst. Okay. And that, it's a catalyst. So it actually facilitates change without choosing what that change is going to be.
Right.
Okay. So that's the first piece. So anything that somebody is, for example, like really good at, right, it's not going to necessarily change what we're really good at or what we value or the ways the brain has changed in a positive
so
direction.
I wasn't thinking of like a specific thing it might be changing, but just if it's changing in general.
Again, if it's a flexibility thing, if it's really flexible, and again, my hands keep doing this, right? Because that's, then it tends to stay in that place. We tend to stay unstuck from things. Human beings, though, we do have. I mean, we have lots on the rim, all of us, right? Yeah. So, pardon me. So many people just, again, they go and they're fine. They don't come back. You know, so they're. And then and it's not just because, you know, it didn't work and they're gone. In fact, you know, longer term follow beside they're still well, and you know.
Is a way of describing it that might be helpful, because you talked about resilience.
Yeah.
And I'm wondering if you're talking about, like, because the way that I understand, like, I have no science background whatsoever, but the way I understand neural pathways is that we have a certain degree of plasticity in our brains that kind of tapers off as we move through childhood, that our brains become less plastic, and that our neural pathways become more trodden, I guess.
Yep.
And so what you're saying, I think the way that I understand it is that building resilience in the brain means more flexibility in terms of pathways that can be, so that you don't keep going down the same pathway.
Yeah.
Because your brain becomes used to certain
Ways
and that's
of
why
being.
pathway, the word, is a good metaphorical description of what the brain does, because we all kind of get these well-worn paths that.
So the disruption would change the pathway that the neuron would take?
If you think about the pathway like a groove we fall into, yeah, right? So it's like, okay, so the same old feelings, right? And so it kind of fills that in so that you can still go there. Right? And sometimes it's going to be appropriate to have that particular emotional reaction, whatever, but it won't necessarily be from, you know, you're not going to fall into it in the same way necessarily. Right?
And that if you're trying to change a behavior, right, like the way that I think about it from the child's perspective, you know, that a child can fall into certain habits of response to emotional situations, and that orientation becomes really strong. But that when you're trying to teach a child to take other pathways, that you're trying to train the brain in some way, right, to have different types of responses to situations, but they sometimes get stuck, and that's what you mean by blockages, is that kind of, that stuckness?
Mm-hmm.
Okay.
Yeah. So I don't know, we're going to train particular outcomes or paths, but more give the brain a choice.
Choices, right?
Yeah.
Okay.
Yeah. So that you don't, you know, tend to always have that, you know, strong reaction when your neighbor does X, right? Or the other, I mean, whatever ways we tend to have. But a more resilient system actually is very efficient, right? So, yeah, works well generally with attention and a number of things. Yeah.
Maybe we could just interrupt just for 1 second, because I know some people have to leave. And maybe we can just end officially here and continue on with questions, if that's okay?
Yeah.
So I just, thank you for coming. Thank you very much. Appreciate it.